Hi, welcome to Brainy Dental. Today I have a guest with me, Dr. Mansi Chatrath from Natural Healthcare Clinic. Recently we did a video together on oral care, which her viewers really appreciated. They had a few more queries, so we thought of doing another video together.
Thank you, Dr. Sumita Sandhu, for having me over. And as you rightly said, our last video on teeth health was highly appreciated, and I have been bombarded with questions. So here I am. Let's try to answer these questions through our kitchen remedies and by your expert medical advice. Our first question for the evening is, what causes bad breath and how can we overcome it?
Bad breath. It's a very common problem, yet an embarrassing one. But it can be easily solved if you know the underlying causes for it. The most common cause is poor oral hygiene. That means you are not maintaining cleanliness of the mouth. So it's very simple, it is very much in your hands. Another common cause is a poor fitting dental appliance in your mouth. That means you have a crown restoration or a crown and a bridge restoration or a denture which is not fitting properly, so it is causing food to accumulate in there. And once the food gets collected, it tends to rot and hence produces bad breath. Then your personal habits like smoking, that causes bad breath. Then sometimes you have a habit of taking a huge intake of food that is odoriferous, like ginger or garlic and onions. So you can avoid that too. Sometimes fungal infection in the mouth also causes bad breath. And then there are conditions when you have dry mouth, that means less flow of saliva in the mouth, and even that leads to bad breath. Now, in case any of these above conditions are not there, then there might be some underlying medical cause which may be causing bad breath. Now, when is it that you have to visit a dentist for your bad breath? Well, in case you cannot solve it at home, then you have to go to your dentist. Now, to solve it at home, first you can improve your oral hygiene. You can check out the foods that you take. You can stop smoking. You can drink lots of water. Now, if after all these measures you still have bad breath, then it is time that you visit your dentist because you need some professional help to solve your problem. He will scale your teeth, clean your mouth, and if there's an appliance which is causing a problem, that can be changed or it can be cleaned. And in case there is no such condition, then you can be sent to a medical professional for your medical status. But all these things will definitely help you.
But as a quick home remedy, honey and ginger juice. Just mix the two in warm water and use it as mouthwash. It's very, very effective and it soothes your gums as well. The other thing you can do is chew cardamom, इलायची, लौंग दोनों का यूज करेंगे आप तो आपका breath better होगा. But still, if there is an underlying medical condition for it, we must trace it out. Hot and cold sensation, the tooth sensitivity, though we addressed this question last time as well, but there have been so many more questions on it. And a quick home remedy for it is salt water rinse. It is very, very effective. But in case salt water rinsing is not helping, then we need medical advice. And I would love to hear what Dr. Sandhu has to say.
Sensitivity of teeth or hot and cold sensation to your tooth. Well, it's a very irritating problem. It is not a problem, yet a problem. Now you must know the reason behind it. See, we have an outer protective layer of a tooth called enamel. Now in the conditions when enamel gets broken or there is some crack or some defect is caused, it leads to sensitivity. Now we must know what are those conditions. Some are in our control and some are not in our control. Now the first one, which is lifestyle related, which is definitely in our control, is to stop vigorous tooth brushing. You know, sometimes we are in a habit of brushing our teeth hard and in a horizontal direction. Well, that causes loss of enamel, especially in the area close to the gums, and which causes sensitivity of teeth later on. Then another lifestyle related problem is avoiding to take too many acidic beverages, your cokes and colas. They can cause erosion or loss or chemical loss of enamel and hence cause sensitivity. Then conditions habits like smoking, they cause sensitivity. Then there are other causes like caries. Now in case there's a caries attack and you have broken enamel, dentine, and your pulp gets exposed, definitely you will have pain and hot cold sensations. Then in the conditions where you have gum problems, you have swollen gums, in those cases not only you'll have hot and cold sensation, you'll also have sensitivity to sweet food. Then in the conditions where you tend to clench your teeth, I mean, some people have a habit of clenching their teeth at night or otherwise also. Now that can cause break in enamel hand sensitivity. And the other cause is your tooth whitening products. Now they have those abrasive content in them. Sometimes if you use too much rigorously these whitening products, you can cause sensitivity to your teeth. So what is the self-treatment that you can do to help yourself? Practice good oral hygiene. That means you keep your mouth clean. And then when you brush your teeth, try and using soft brushes and brush gently and brush in a correct manner. And avoid horizontal brushing of the teeth. Avoid drinking colas and beverages, and you can avoid smoking. And then avoid clenching the teeth. Try and break that habit. Now, in case all these things do not help you, then it's time to visit your dentist. The dentist can help you in a lot of manner. Supposing your sensitivity happens because of the cavities that you have developed in the neck of your teeth, that means in the area close to the gums, then fillings can be done there. Treatment of the gum disease can be done with help of scaling and curettages. And to avoid clenching, the doctor can give you mouth guards. I mean, you put them at night and you avoid clenching that way. And then you should avoid over-the-counter whitening products, and then proper bleaching can be done by the dentist, or any other whitening procedure can be done, which can be controlled and it won't really harm you. So if you take all these measures, you can definitely be helped.
Another very common problem, grinding of the teeth. Lots of people, even children, we grind our teeth during sleep, and many do it during the day as well. And how can we get rid of it?
Teeth grinding, it's a condition in which when you sleep at night, you tend to grind your teeth. Now, there are different causes for it. The most common one is mental stress. You may be stressed about something, and that comes out in this manner, that you're grinding your teeth when you're sleeping. Then another condition can be abnormal bite or abnormal restoration or a broken tooth or a loss of tooth in your mouth. That means when you're closing your tooth, the bite is not properly getting occluded or it is not properly closing. So you tend to maybe grind your teeth or put them in a position in which you're creating a lot of stress. Then sleep disorder.
Majority of the times, grinding of the teeth happens because of the deficiency of magnesium in the body. So, food products which are rich in magnesium, things like pumpkin seeds, almonds, cashew nuts, छोटा सा ट्रेल बनाएं तीनों का और रोज खाएं हैंडफुल ऑफ देम. गर्मी आ गई तो आमंड्स को सोक करके खा लें. This will really help you in bringing up your magnesium levels. In fact, I have done one complete video on YouTube on deficiency of magnesium. So magnesium levels, as they come up, it would definitely help you in the grinding of your teeth.
And now, how do you come to know that you're grinding at night? Well, if you wake up in the morning, you have a dull headache and you have sore muscles of the jaw. That means you have sore muscles somewhere here. They're tender. That would indicate that quite possibly you're grinding at night. And very commonly we come to know about grinding from the sleeping partner, because when a person grinds at night, they tend to produce a sound and that can be heard. And also if you check the mouth, the top surfaces of the teeth, they are flattened because excessive forces that were used at night, so it causes flattening of the teeth. So all these things, they indicate that the person is grinding at night. You can train yourself to stop grinding. Now, during the day, when you catch yourself grinding, what you do is you stop, place the tip of your tongue between your front teeth, and position it there for some time. In this way, you try and break your habit. Then you can bring some lifestyle changes, like avoid taking alcohol before sleeping, or coffee, or beverages like cokes and colas. I mean, if you do that, they all tend to increase the tendency to grind at night. You can help your muscles relax by taking a warm, wet cloth and placing it under your earlobe, somewhere here. And that will give you a lot of relief. Now, if with all these conditions you are not able to stop your clenching habit, then it's time that you visit your dentist. When you go to your dentist, he will give you a very simple appliance called a mouth guard. It will be fitted in your mouth and you will use it at night. And that will help you break your habit, and it will protect your teeth from the harm that you cause when you use excessive pressure and while clenching your teeth. For your sore jaws, muscle relaxants can be given. In case you have a sleeping disorder, then proper treatment will be given for that.
This has been a very, very knowledgeable session. Thank you, Dr. Sandhu, once again to have me over. And let's do another session very soon and answer the rest of the questions as well.
Thank you, Dr. Mansi, for joining me in this video. And I hope all the viewers you found this information helpful. And while you're here, do like this video, share it with your friends, and subscribe to the channel. Thank you.